If you or someone you know lives with type 1 diabetes, you probably get this really deep fear. It's about that sudden, dangerous drop in blood sugar, hypoglycemia.
It's a constant worry.
Yeah, a constant sort of silent threat, especially, at night or for kids. And the current way to handle emergencies often means injections, which just adds, well, a whole other layer of stress.
Definitely a big challenge.
So today, we're doing a deep dive into something that tackles this head on. We're looking at research published July 9th, 2025 in Nature Biomedical Engineering.
Right. The paper's called Implantable Device Prevents Hypoglycemia and Anaphylaxis. Really interesting work.
It really is. It features work by MIT engineers led by Daniel Anderson and Siddharth Krishnan, among others.
Key names in the field.
Absolutely. So our mission here is to unpack this pretty revolutionary implantable device. It promises an automatic hands-free response in emergencies.
Which could be huge.
Exactly. It's about how smart engineering can address this very real human vulnerability. So stick with us, and you'll get the lowdown on what this thing is, how it works, why it's such a potential game changer, not just for diabetes, but maybe broader, too.
Yeah, its potential reach is quite surprising.
Okay, so let's dive in. First, let's really paint the picture of hypoglycemia for type 1 diabetics. It's not just feeling a bit off, is it?
No, not at all. We're talking dangerously low blood sugar. And if it's not treated fast, it can lead to disorientation, seizures, even coma.
And worse, potentially. It's life-threatening.
It absolutely is.
And the really insidious part, the thing that keeps people up at night, is spotting those early signs. It can be so hard, right?
Yeah.
Especially for kids or, like you said, when you're asleep.
Alarms help, but they aren't foolproof.
And the research actually mentions people can just slip into confusion and coma if they don't realize what's happening. That's terrifying.
It is. And that brings us to the current standard treatment. If someone has severe hypoglycemia, what do we do now?
Usually an injection, right?
Glucagon. Exactly. Glucagon, it's a hormone, tells the liver release sugar, quick. But think about the catches. You need to be able to inject it yourself or have someone there who can.
Which might not be possible if you're already confused or passed out.
Precisely. Or just asleep. There's that constant fear, what if I can't react in time? So the big question this research tackles is how do we make something reliable, always ready for those moments?
Okay, so faced with that challenge, the timing, the need for someone to act, what did the MIT team come up with? What was their big idea?
Well, they developed something pretty ingenious. It's a small implantable device. Sits right under the skin.
Implantable, why?
Yeah. And it's designed to give that emergency response automatically. No injections needed. This comes from Daniel Anderson at MIT, Siddharth Krishnan, who's now at Stanford but was at MIT, and Robert Langer, also MIT. Big names.
Okay, implantable. That makes me think.
Yeah.
Keeping the medicine stable inside the body for a long time must be tough. How did they crack that? Especially with something like glucagon.
That's a great question. And it's actually a really clever part of the design. The device itself is small, maybe quarter-sized.
Tiny.
Yeah. And inside, it holds glucagon, but, and this is key, it's in a powdered form.
Powdered, not liquid.
Right. Because liquid glucagon breaks down pretty quickly. Powder stays stable much, much longer. So potentially, it could sit there ready for a long time.
Okay, that makes sense. Years, maybe.
That's the hope. Imagine the difference that makes compared to worrying about expiration dates on injections, especially, for parents.
Yeah.
Huge peace of mind.
Absolutely. So powdered glucagon solves the stability issue.
Yeah.
But how does the device actually release it when needed? With the mechanism? Sounds like fancy engineering.
It is pretty sophisticated, yeah. So the drug is held in this reservoir, which is actually 3D printed from a special polymer.
Okay.
And it's sealed shut with this fascinating material. It's a nickel titanium shape memory alloy.
Shape memory. Like it remembers a shape.
Exactly. It's engineered so that normally it's flat, sealing the reservoir. But if you heat it just a little bit, to about 40 degrees Celsius.
Not very hot.
No, just body temperature plus a bit. When it hits that temperature, it physically changes shape. It bends into a kind of U shape.
And that opens the reservoir.
That's right. It unseals it, letting the powdered drug out.
Okay, but how does it get heated? It needs a trigger.
Right. It has a tiny antenna inside. It's designed to respond to a specific radio frequency signal sent from outside the body.
Oh, wireless.
Wireless, yeah. So when that signal comes in, it activates a small electrical current. That current generates just enough heat to warm up the alloy, make it bend, and pop open the seal.
Wow. That's intricate. And can it do this multiple times?
The designs they tested could hold either 1 dose or 4 doses. So yes, potentially multiple uses before needing replacement. It's like a tiny automated pharmacy under your skin.
And crucially, this isn't just triggered by someone pushing a button, right? You
Mhm.
mentioned it tackles those unaware moments. How?
Exactly the point. Because it's wirelessly triggered, it can talk to other devices, specifically continuous glucose monitors, CGMs.
The sensors people wear already.
The very same. So you can program the system so that if the CGM detects blood sugar falling below a certain critical level, boom, it automatically sends the signal to the implant.
Triggering the heat, the bending, the drug release,
Yeah.
all without the person even needing to know.
Precisely. It bypasses the need for conscious awareness or manual intervention. That directly addresses that terrifying, unaware hypoglycemia problem.
That is genuinely game-changing potential. But you hinted it might go beyond diabetes.
I did, and this is where it gets potentially even broader. What's fascinating is the researchers showed the same basic technology. The reservoir, the shape memory alloy, the wireless trigger could also be used to deliver epinephrine.
Epinephrine, like in EpiPens.
Exactly. The stuff used for severe allergic reactions, anaphylaxis, and also sometimes for cardiac arrest.
So the same device, just loaded with a different emergency drug.
Potentially, yes. Which leads to this idea, Robert Langer actually suggested it might be a new paradigm for delivering any emergency medicine.
Wow. It's not just diabetes, not just allergies, but a platform technology.
That seems to be the vision, a universal implantable emergency system.
Okay, this all sounds incredible on paper. But did it actually work in tests? What did the preclinical results show?
They did test it, yeah. Primarily in diabetic mice for the glucagon part. And the results were really promising.
How quickly did it work?
Very quickly. After the glucagon was released, the mice's blood sugar started to stabilize in less than 10 minutes. It brought them back into the normal range, effectively stopping the hypoglycemia.
Less than 10 minutes. That's fast.
It is. And they saw a similar rapid response with epinephrine blood pressure, and heart rate went up within 10 minutes too. So the delivery mechanism seems effective and quick.
Okay, that's great proof of concept. But thinking long term, for a device inside the body, what about practical things, like how long would it last?
Good question. Well, longevity is definitely something they're working on. In the published study, the implants were in place for up to 4 weeks.
Okay, but ideally you'd want longer.
Much longer. The
Yeah.
goal is to get it to last at least a year, maybe even a few years, before needing a replacement procedure.
And what about the body's reaction? Implants often get scar tissue around them, right? Does that interfere?
That's a classic challenge with implants, yes.
Uh-huh.
Fibrotic tissue, scar tissue. But here's another really encouraging finding from their study. Even when scar tissue did form around the device, they could still successfully trigger the drug release. The mechanism worked right through it.
Oh, that's huge. That removes a major potential roadblock.
It really does. It suggests the design is robust against that common biological response.
So with these positive signs, what's the road ahead look like? When might we see this in humans?
Well, the immediate next steps are more animal studies, probably larger animals, to gather more data on safety and long-term function.
Makes sense.
After that, they're hoping to move towards clinical trials in humans, maybe within the next 3 years or so. That's the target timeline.
Still ways off, but definitely on the horizon. And it sounds like there's significant backing for this.
Oh, yeah. It's got support from some major players. The Helmsley Charitable Trust, the NIH, JDRF, the big Diabetes Research Foundation, and the National Institute of Biomedical Imaging and Bioengineering.
That level of funding usually signals pretty high confidence in the potential.
It certainly suggests that the scientific community sees the promise here.
Okay, so let's just quickly recap what we've covered in this deep dive. We've looked at this really innovative implantable device, tiny thing.
Quarter size.
Holds powdered emergency medicine like glucagon, keeps it stable. Uses a smart shape memory alloy seal.
Triggered wirelessly.
Wirelessly, yeah. And critically, can be linked to CGM sensors for automatic release during hypoglycemic events, even if you're asleep or unaware.
Eliminating that need for manual injection in a crisis.
And potentially, the same tech could work for other emergencies, like anaphylaxis, using epinephrine, a platform technology.
Or a potential paradigm shift, as Langer put it.
So it really makes you think, imagine a future where, a tiny, almost invisible implant could be protecting you or someone you love from various sudden, life-threatening events.
It changes the whole concept of emergency preparedness.
It really does.
Yeah.
It makes you wonder, what other critical fast response medical needs could this kind of tech tackle? How could it fundamentally shift how we think about personal health safety and emergency care down the road?